Am I permitted to use invasive procedures? Can I administer drugs and supplements? You could do research involving supplements. The answer is not a wholehearted no, but again, one would treat with extreme caution. You need to defend and explain why you are going to, what the benefits of the area of the drug you're using, and why what are its potential benefits to the knowledge, and what the risks the participants are, how frequent it's being used, and how well known. In other words, how well known are those risks. You can't do anything illegal, so you can't do a study that tests the effect of steroids, because that would mean your participants who would immediately at risk of being caught for cheating, and that is against the rules. This is one that you need to speak to the expert, your supervisor, just to find out if this is possible. At a PhD level, it's likely. At an master's level, it's possible. An undergraduate level, I would suggest, is highly, highly unlikely. It's likely to be a B category project, and therefore high risk. And you need to be really, really clear and persuasive as to say that you can take part in this. You could run this study. It's likely that the supervisor would be the one who was giving the supplements. This is again which needs to be treated with super caution, in that you must be qualified to be able to administer the treatment of drugs that are being looked at in the study, in any study. So if it's caffeine, for example, and it was a caffeine drink, and that might be a dose no more than a couple of cups of coffee, then that project's possibly likely. And there was research previously that looked at relatively small amounts of caffeine as an antigenic aid. If it was the effects of one of the various energy supplements, such as the gels that people take during the marathon running, and which are commonly bought off the shelf, then that would be possible. If it was something which was involved administration of a drug directly into the blood, supervisor who's trained in bloods is the person who would be able to say yes or no as to whether he or she would be prepared to run that project. Again, it's proceed with caution, see the supervisor, read the literature, and then reread the literature so that you know what you're talking about. Can I deceive my participants as a conscious part of my procedure? Am I allowed to use a placebo, like a small lie, to try to obtain a true reflection of their behaviours? That's possible, but again, it needs to be explained really, really clearly in your methods as to why you're going to be doing that, what the benefits of doing that, and why the study can't operate without the placebo being absolutely vital. And so there's a yes, but it's a really reserved one in that you must be able to explain that really, really clearly. I'd say in most undergraduate projects you're likely to hit a roadblock when you're trying to do a deception part research, in that it's because the arguments are often not presented as strong enough, and on the grounds of safety for the participants involved, ethics committees tend to turn those down. They almost always take a couple of goes to get through. So what you are setting yourself up for, and this is a really important part in terms of planning of your project, is the fact that it will be knocked back a couple of times, which delays you in terms of time. It's more difficult to get participants. You need to really brief participants in terms of what's going on. It's difficult to get participants because all your friends and many of your course members have an idea of what you're doing, and people need to be totally blind to the project in order to have the deception to have any give any chance of being carried out. I would urge with great caution on this. It's likely to be a no, and therefore think of a different project. Okay, what happens if I don't get ethical approval? I just go and collect the data. Go and get the data. Don't get ethical approval. Don't run this through the ethics committee. What happens? What do they do? Do you think the fail it? What happens? What do you think happens? Do you think it's do they look at that favourably or not favourably? Not going to ask it. That might be the consequence.